1. How many total vertebrae are in the vertebral column? 30. B. 32. C. 33. D. 35.
Answer: C. 33. Explanation: the vertebral column contains 33 vertebrae, 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, and 0.4 fused coccygeal. 2. How many cervical vertebrae are there? A. 6, B. 7, C. 8, D. 5. Answer: B. 7. Explanation: there are always 7 cervical vertebrae in humans, labeled C1 to C7, regardless of the neck's length. 3. Which vertebrae are fused to form the sacrum? A. 4, B. 5, C. 6, D. 7. Answer: B. 5. Explanation: the sacrum is formed by the fusion of 0.5 sacral vertebrae during adulthood. 4. Coccyx is formed by fusion of how many vertebrae? A. 3B, 4, C. 5D, 2. Answer: B. 4. Explanation: the coccyx usually forms from 4 rudimentary vertebrae at the base of the spine. 5. Which vertebral regions show primary curvatures? A. Cervical and lumbar. B. Thoracic and sacral. C. Lumbar and sacral. D. Cervical and sacral. Answer: B. Thoracic and sacral. Explanation: primary curvatures are present at birth, thoracic and sacral. 6. When do secondary curvatures develop? A. During fetal life. B. During puberty. C. After birth and infancy. D. After adulthood. Answer: C. After birth and infancy.
Explanation: cervical curvature develops with head lifting, or curvature with walking. 7. What is the function of the vertebral column? Only supports the head. B. Protects lungs. C. Protects spinal cord and supports body weight. D. Only helps in digestion.
Answer: C. Protects spinal cord and supports body weight. Explanation: it supports posture, head, trunk, and protects the spinal cord. 8. The cervical vertebrae are part of which curvature type? A. Primary. B. Secondary. C. Abnormal. D. None. Answer: B. Secondary. Explanation: the cervical curvature is secondary and develops after birth. 9. Which vertebra has the longest spinous process in the cervical region? A. C1B, C2C, C6D, C7. Answer: D. C7.
Explanation: C7 is known as vertebra prominence due to its prominent spinous process. 10. The vertebral column articulates with ribs mainly at which region? A. Cervical. B. Thoracic. C. Lumbar. D. Sacral.
Answer: B. Thoracic. Explanation: ribs articulate with thoracic vertebrae at costal facets. 11. Which vertebral region supports most of the body weight? A. Cervical. B. Thoracic. C. Lumbar. D. Sacral. Answer: C. Lumbar. Explanation: lumbar vertebrae are large and carry the body's weight. 12. Which structure lies anterior to the spinous? Processes on radiograph? A. Rib. B. Clavicle. C. Trachea. D. Sternum. Answer: C. Trachea. Explanation. The trachea is seen anterior to the spine, in radiographs, especially a P view. 13. What structure terminates as the conus medullaris? A. Spinal cord. B. Cauda equina. C. Filum terminale. D. Dura mater. Answer. A spinal cord. Explanation. The spinal cord tapers into the conus medullaris at L1-L2 level. 14. Which structure lies below the conus medullaris? A. CSF. B. Spinal nerve roots, Cauda equina. C. Aorta. D. Sacral promontory. Answer. B. Spinal nerve roots, Cauda equina. Explanation. The Cauda equina extends from below the conus medullaris. 15. Where is the ligamentum flavum located? A. Anterior to vertebral body. B. Between laminae. C. Inside intervertebral disc. D. In the sacrum? Answer. B. Between laminae. Explanation. Ligamentum flavum connects adjacent laminae posteriorly. 16. What is seen between vertebral bodies on MRI? A. Epidural fat. B. Ligamentum flavum. C. Intervertebral disc. D. Lamina. Answer. C. Intervertebral disc. Explanation. Intervertebral discs serve as cushions between vertebrae. 17. What is found in the epidural space? A. CSF. B. Blood. C. Epidural fat. D. Spinal cord. Answer. C. Epidural fat. Explanation. Epidural space contains fat and venous plexuses. 18. Which vertebra has the odontoid process, dens? A. Atlas. C1. B. Axis. C2. C. C7. D. T1. Answer. B. Axis. C2. Explanation. The dens projects superiorly from the axis and articulates with the atlas. 19. What feature is unique to cervical vertebrae? A. Large body. B. Costal facet. C. Transverse foramen. D. Mamillary process. Answer. C. Transverse foramen. Explanation. The transverse foramen transmits vertebral arteries and cervical vertebrae. 20. Which vertebra lacks a vertebral body? A. Axis. B. Atlas. C. C7. D. T1. Answer. B. Atlas. Explanation. The atlas C1 has no body. It forms a ring for the skull. 21. Which process is present in lumbar vertebrae but absent in cervical vertebrae? A. Accessory process. B. Transverse process. C. Spinous process. D. Answer. A. Accessory process. Explanation. The accessory process is a muscle attachment site found in lumbar vertebrae. 22. What is the function of the mamillary process? A. Protect spinal cord. B. Connect vertebrae. C. Muscle attachment. D. Form vertebral arch. Answer. C. Muscle attachment. Explanation. Mammillary processes serve as attachment sites for deep back muscles. 23. Which vertebral type has costal facets? A. Cervical. B. Thoracic. C. Lumbar D. Coccygeal. Answer: B. Thoracic. Explanation: thoracic vertebrae have costal facets for rib articulation. 24. The sacral promontory is located at the junction of which bones? A. L5 and S1, B. T12 and L1, C. C7 and T1.D.S2 and coccyx.
Answer: AL5 and S1.
Explanation: the sacral promontory is the anterior dot projection of S1. 25. Which structure appears bright on T2 weighted MRI? A. Vertebral body, B. Spinal cord, C. Ligamentum flavum, D. CSF. Answer: D. Cerebrospinal fluid, CSF. Explanation: on T2 MRI, CSF appears bright, clearly surrounding the spinal cord.
Did you get it right? Comment below, subscribe for more high-yield physiology mix. Thank you for watching.